Welcome to Learning Unit number 5. In Learning Unit number 5, we're going to be talking about HFE, or Human Factors Engineering, a little bit about patient engagement, and nurse residency programs, also known as transition to practice programs. So let's click on and see what our topic and activities will be for the week. So, in Learning Unit number 5, we really focus on these three healthcare related safety strategies. These three strategies have been shown to have a significant impact on nursing care and patient safety. And that's human factors engineering, patient and family engagement, and transition to practice programs for new nurses. We're going to end up by submitting our PICO question and literature review assignment. So for this learning unit, we have a couple of outcomes that I ask that you read through, and I've decreased the amount of readings. So typically we had chapter 7 and 21. But there's a lot of work to be done in a very short period of time, and I'd like you to focus on what I thought was a little bit more essential materials. So please do read Chapter 7 in our Patient Safety ebook, and that is on human factors engineering. Chapter 21, if you do have time, goes into more about patient engagement, but that's not required. So you're watching this video, and there's going to be three folders. One, patient and family engagement in QI, one, human factors, and one, retaining nurses, both novice and experts. And we're going to look at a new initiative that UPMC hospitals have put into place for their transition to practice program. This new initiative is called the TSAM, or the Tiered Skills Acquisition Model. So it is, in my opinion, an excellent orientation model for both new nurses, novice nurses, and new nurses to UPMC hospital. They could have had experience from other hospitals. And then we're going to read just an evidence-based care sheet on retaining older nurses, because the changes in the average age of a nurse who is working at the bedside has decreased significantly in the past few years since the COVID epidemic. So you're going to complete discussion board number 5, and then complete and submit via the Dropbox your PICO question and literature review. So it's another busy week. And here is your readings again, chapter 7. If you're more interested in patient engagement, patient and family engagement, you can look at chapter 21. So in the first folder, you're going to see we're finishing up our article from Zero Harm in Healthcare and a brief opinion paper by a physician about having family in rooms, how it impacts care. The next folder is the human factors. There's a simple picture here that I kind of like having that visual, and also information on human factors engineering in addition to chapter 7. The next folder is retaining nurses, both older nurses and again the TSAM model. Discussion board number 5, you're going to choose one category of a patient safety, healthcare safety strategies, either HFE or TTP, transition to practice programs. Then share how this safety strategy applies to your project or initiative. If it does not, if you can't figure out a way to really make it, it's like putting a square peg in a round hole. If it's not fitting, just do a nice discussion board on your healthcare related safety strategy. Because I do want, typically, I want you to share a bit about your patient safety initiative with classmates. I know it's not as essential this summer as other summers, but read through the discussion board, and then you're going to see that the clinical course assignment, the Dropbox is here. You can go back to last week, learning unit number 4, to see the other information as far as the rubric and instructions for completing this in learning unit number 4. Or remember, all of this information was posted in the Start Here tab, the first tab that you had for this course. So that's learning unit number 5. This was our last full learning unit for our summer course that just goes by way too fast. Lots of content, 4 credits. So I know you have been extremely busy. Thank you for all that you do and for the wonderful work that you do. And that is the completion of this learning unit. Learning unit number 6 is just very short as far as time, and that will be open to you at the same time so you can see your final course reflection.